All right, you can go
Okay.
ahead.
All right. Hi, I'm Elvi Whiteford. I'm a family medicine doctor in Grand Junction, Colorado. I work in a direct primary care setting currently. My past life was being a faculty member at a residency that is also local in Grand Junction. So my background and passion is definitely primary care, but then I love education, and then transitioning to direct primary care was a nice transition because direct primary care allows me so much more opportunities to have one-on-one with patients. So it made that transition much easier than if I was required to see a patient every 15 minutes and not invest in who they are or that education. I grew up actually where I'm practicing now. I grew up on Western Circle, Colorado. So I was a little Montrose born and raised young lady, went out to see the big world in medical school, did residency and a fellowship. And then I just really could not wait to come back to kind of my roots. And moving to Grand Junction was close enough to Montrose that it allowed me to see my wonderful family. But then it was a great move also for my husband who's in education.
Oh,
So
perfect.
we've been here now for almost 13 years. Back here.
Exactly. Exactly. Well, great. Well, I would just love to hear how your daily life has changed, both maybe work and personally, with this pandemic and what you're doing.
Yeah, so um, the world paused. Everybody kind of like hit that pause button. So, in my professional world, again, working for direct primary care has been a huge blessing. We don't bill in the fashion that regular traditional medicine does, and
Mhm.
so already in place were a lot of things that made that transition for pausing really super easy. I was already used to doing telephone visits because I don't worry about billing. And so if I had a patient who had a diabetes follow-up, but they happened to be on vacation somewhere, we could call and I could talk to them already and not worry about the impacts of how do I make money being a doctor offering care. So I
Mhm.
feel for our office, the transition was easier. And then the billing piece for us, we weren't worried about that. We were
Mhm.
like, we don't need to worry about that piece because we don't. We're blessed in that facet.
Right.
We still did a lot more telemedicine though, and that was out of respect for our vulnerable patient population as well as our staff. And
Mhm.
so there were many days where instead of going to the office, I would bury myself into my little work office at home, and I would sit and do what we're doing right now, which is telemedicine.
Mhm.
And of course, I miss my patients, but it was great to still be able to quickly roll into that so they weren't trying to wait, or I wasn't laying my staff off because I already had that
Mhm.
income. So there were a lot of positives happening, but we tried to make it a win-win from the medical being able to provide it, as well as the business structure for the people who from our front office to the back office. So that was a real positive. And then as my personal life, while I'm buried in my office trying to talk to patients, I got the dog barking. I got my kid like, Mom, yeah, get on Zoom. I got my teenager like texting him like, are you on Zoom? What's going on behind there? And so the family life, of course, has really like shifted dramatically. But
Mhm.
my husband and I were talking about even with the boys, like what have we gained from this instead of what have we lost. And the relationship of my two boys as brothers has been there, but we call them Mr. Green and Mr. Blue because their colors are different spectrums and we didn't want to call them black and white. um,
Yep.
and so one is Huck Finn, the other one is Albert Einstein. And so they are brothers and they care about each other, but there's their world. And in the last 3 months, we've seen this beautiful transition where they want to sleep in each other's rooms, which is
Wow.
like, what? They're riding their bikes together to go, see something because we live in Junction, so you can go see dead vultures picking at skunks, which is what they did
Mhm.
yesterday. Because I'm like, where were you guys? And that reopening of, I remember when I would leave my house, I'd be gone for hours, and my parents didn't care. And
Right.
I think for a long time of my parenting, like, where are you at?
Right.
with micromanaging, but here my kids came back like 4 hours later and I didn't track them on their phone. I was just excited, like, what were you guys doing out there? Like, there was this vulture and it was like picking at this skunk. I'm like, did it smell? Well, it did. We went downwind. And just the brother bonding and the simplicity of allowing that to happen. I think some of the things that we've tried to really highlight, and not necessarily the fact that things like personal trips and not being able to see grandparents that are close to us in the community, trying to focus on some of those positives is where we've been trying to let the kids reframe with the right frame.
Right.
But
Right. Oh, that's great. That's great. That's really good that you'd already started in on that telehealth. That's
oh,
amazing. What did you have new challenges with it? I know out
oh,
there, I've heard a lot with the getting to the rural communities and being able to have that.
so we the video part we were not good at, and I think that that was an obstacle because a lot of people don't have good tech, especially in rural areas. Even when they would get it, I'd be like, push the mute, you're on mute, and they'd be talking away. I'm like,
Yeah.
mute. Yeah. And so I think that there were still some of those obstacles. So a lot of our patients, if I saw that they were on video chat, I'm like, I know we offer that now. Do you guys just want to go to phone, and not feeling like we had to be bound by the new technology and just
Oh,
using what
good.
we had? We there are times where it was like, okay, wait, you got to take a picture of it. I don't know really how you're rotating your arm. Let's try the video chat again. But I
Right.
think that just respecting, we don't have to use the tech just because we had it. And if
Right.
that was for, a diabetic follow up, I'm like, like just send them a message, like, we can do this on the phone. If it was for one of my depressed patients, realizing that face contact needed to happen because that's
Mm-hmm.
what they were missing. They needed that social piece, not
Right.
necessarily social through the phone. So I think that we were able to do that, but you're right, in rural areas, that was a huge obstacle.
Okay.
And then I think like the American Academy of Family Medicine really was very excellent in saying, here's how you guys can start to very quickly bill for Medicare, Medicaid, which again, I didn't have to worry about, but I appreciated having really strong, you know, board support so that rural providers could do it, and also then trying to get the tech to match it, but then giving
Mm-hmm.
ourselves that permission, like, just because you're trying to get that match, use it for the right visits.
Right.
um, and then I do have my local providers that are doing typical billing and talking to them like, how you doing? Like, it's hard because I'm laying people off and I'm furloughing my nursing staff because they're just not doing anything, and being proactive with them and asking like, well, could they do things that they're not used to doing so you don't have to furlough them and you can still pay them? Like, could they call the elderly and ask them about, hey, have you thought about end of life? Not that COVID's going to get you, but we should have had these conversations before. Like, can they be meaningful in that way? Or on the patients that we can pull that have a depression diagnosis, can we call and outreach them? Like, that should be part of our primary care responsibilities. And so talking to some of my colleagues, like, that's awesome, LB. That's a great
Yeah.
ability for our staff. And I'm like, why am I telling them my ideas? And then we pulled our staff into it. It's like, hey, they're trying to work on billing that I'm not, but this is still things that we should be doing for our patients. So some of it is creativity and just talking to and networking with your local providers.
Right. Being able to do those things that you want to do but don't always have the time.
Right, exactly.
That's wonderful. How has your staff done? And what precautions are you taking when you do go into the clinic?
Our staff, because again, if I'm not in the clinic all day, my MA doesn't need to be there either. But then giving her those tasks to do, like, hey, Caitlin, can our top 5 needies,
Yeah.
they need us. So those kind of delegations have been really good. We've still, because again, direct primary care is a blessing in many ways, we've been able to keep
Yeah.
them paid to their normal pay grade, which has been nice for them, even though they're not working. So I could say to my MA, I'm only going to need your help for probably a couple hours. If you
Mm-hmm.
check in on your login between 1 and 3, I'll give you a bunch of tasks. So we've tried to keep them also home. Now that we are integrating more into the clinic, we've done a couple different things, and this is still just learning quickly. Everything from, if I'm going to be exposed, maybe I should be the one doing all of the vitals.
Mm-hmm.
So, you know, we've at the front door, they have to have a scheduled appointment. We do have one person kind of as the point person protected up scanning, because if they're asymptomatic, we're going to want to do a different layer for everybody involved.
Right.
And then just, you know, even I was in clinic yesterday and there was a patient who came in, probably not COVID, but it turned into a COVID situation potential pretty quickly. But it felt good to have like this shared mental mindset, almost like when you're on an airplane and everybody says, put your seatbelt on, everybody knows what to do. When I came out of the room and I'm like, we need to be safer. That was kind of our code. Right away, my team had my, you know, my N95. They had a gown for me. They had plans for the other staff. So it felt good to be able to practice some of those things. And those came from the staff. Like, we're like, how do we do this to keep you guys safe?
Right.
Even some of our testing, because we have a health department that's testing for COVID, nasopharyngeal, oral. We have a connection with Quest. So we've been able to, I don't want to use the word bypass, but their system is very bottlenecked.
Mm-hmm.
It's hard for us to get our patients access to those opportunities, and then to get the results back was another bottleneck that was coming through, that we were like, okay, the lab that we have a connection with is letting us do this, but if we're going to offer it, how do we do this the safest for our patients and our staff?
Right.
So a lot of kudos to my organization for very quickly saying, car triage, staff, what do you think about being frontline? How can we make it the safest? And so we put signs up for patients if we were going to do testing to say, you call this number, you don't get out of your car, you wear a mask, don't remove the mask until you're told to do so, and then batching those. And so batching them towards the end of the day. So then that way there's one person who's designated that day to be the tester. Of course, in between, and we weren't doing volumes, Eric. I don't want to make it sound like these this great, like, what's Mesa County doing? No, we probably do 1 or 3. But the point of the thing was, is if we needed to do it or increase it, we had the thoughtfulness behind it. And even if it was one person coming in between 3 and 4, that staff member, after they were done, swapped out their clothes, washed their hands in kind of a mudroom area that we had, and they left.
Okay.
Them being in, and then their day off was the next day, so they weren't going to be coming back. And then we rotated kind of our staff into that setting.
Right.
So those were some of the things that I mean, we're still not perfect at it. We're still working on it, but I think when I talked to my Dr. Craig Gustafson is the founder of Appleton Clinics where I work. And whenever we're chatting, he's such a great listener, and because he's like, what crazy ideas do you guys have? And I'll actually sit there and open it up, but then as we're throwing crazy ideas, he can pull things in like crazy. He's probably thinking this crazy. Hey, what you guys just said there, somebody was saying batching testing. Let's talk more about that. Let's massage that. And so we're having weekly Zoom meetings as a group so that we could continue to roll this out. You know, Craig would always say, like, I've never been in a pandemic, guys. We're in this together. I might have started Appleton, but we all need to figure this piece out as we roll. And I think that continued support and leadership and making everybody feel like they are part of the team from the front to the back and everything in between has kept us changing things and reevaluating successes. And even the good example I gave you where I could come out of a room and say, we need to be safer. Afterwards, I'm like, guys, we did great, but how could we do better next time? Because we're not done with COVID. I wish we were. Mesa County is super blessed, but we're not. So how do we make this even better? Because I love you guys, but you were all circulating in the hall. You didn't need that many people circulating, even though you wear a mask. Like, we need to be better about stations. What do you think about that? And have them say, that's true. Maybe we need to have arrows. So just from yesterday, the team is already starting to be like, our clinic is kind of circular. And so even though it's going to be more steps, we're going to get our 10,000 steps in. Maybe we start to be thoughtful about area flow too. We're still rolling and working things out.
That's great. That's great. I love that camaraderie, that everyone has that input.
Yeah.
Because that's what's so important.
Yeah. And go ahead.
I was just going to say, have you had any staff or nurses, MAs, or even other physicians that have kind of questioned, the thought of that going into medicine, or do you think that that is going to change, that people will continue to go into medicine? What are your thoughts on that?
Yeah, I'm excited about where, again, looking for the positives in things. I think that this is going to open up a lot of opportunities for rural medicine, for specialists. I was on the phone with a patient who I'm pretty sure has probably Graves' disease or Hashimoto's thyroiditis, but she really has wanted to see an endocrinologist. And we don't have one in Junction anymore. And the thought of having to go to Steamboat or to Eagle or all the way to university has been a restrictive thing for her and her thought process. But with COVID, telemedicine is something that she couldn't be offered before. And so
Right.
I was talking to her, I was like, look, we've been playing with this. You've been, on methimazole. You're trusting me, but always questioning with great questions. What would endo do? Let's use telemedicine. And so I think that that telemedicine piece is going to ignite people to get excited about medicine in a
Mhm.
new way. So I'm hopeful that it won't just be for the specialists, but we're going to be offering more primary care, and we're going to get our medical students more excited that they're going to be making an impact. This
Mhm.
next generation of people who are going into medicine, they are so exciting. They're so global, and they think of things in big pictures that we never did. And
Mhm.
now this might be the next spark to get them excited about primary care. So I
Right.
don't know if I haven't talked to any of them to say like, hey, is this going to be more exciting? But when I work with medical students and when they're like, God, primary care is a lot. Like, I have these huge student loans and you make crap. Like, I don't know if
Uh-huh.
I want to do that or work that hard. But if they want to work passionately. I
Mhm.
don't think I think they will work hard, but they are about passion. And if they see that they can't do something with passion and they have to suck their life into it, that's not what their generation is about. But if they can get
Right.
excited about seeing a big picture and having passion and making it work, that's where I think COVID is going to give us some great lessons and opportunities.
Mhm. That's great. I think that telehealth is just going to be huge, and I'll be interested to see really how it continues and how it's going to be reimbursed and
Yeah,
how that's going to change.
yeah.
So.
I think the other merit that I'm hopeful to see is um, I'm always pausing to make sure I'm thinking about unity and not about breaking down systems. But for a long time, I think hospitals have made decisions for physicians instead of, and not just for physicians, for all medical staff, quite
Mhm.
honestly. And so I'm hopeful that that tide will also have the opportunity to change. So there is that continued renewal of medicine joy, not just for the new people coming in, but for the
Right.
people who will continue to be in it for the long haul. So again, being unified is important to me, but I think
Right.
that there will be opportunities to improve where we have made huge mistakes. And
Mhm.
this will be a door open.
Right. Right. What do you think some of those learning opportunities are going to be for us when we go back and think about education and how we're training healthcare staff, providers?
Yeah,
Yeah.
I think some of them that I've mentioned, for sure. Um, I Community outreach, I think I'm hoping will also be a big piece of that, Erica.
Mhm.
I think that for a long time we've thought about medicine as far as we're going in to do this to people. And I hope that this piece of COVID really pours out that we need to bring people into that education piece. People are craving information like crazy on COVID.
Mhm.
That's kind of what I've really appreciated with my Facebook page is it's like that, having the same question asked multiple times in different ways is an opportunity to realize that people are craving information.
Right.
I think in medicine, we're used to directing, like, it's you're diabetic, you do this,
Mhm.
without really recognizing and pulling in that piece of education and having them ask the same question 50 times to get the right answer for that person. And so I'm hopeful that there's going to be that piece of, I can know every part of physiology and every drug on the market, but if I can't engage that patient on how to get to a better place, it doesn't matter how much I have in here without that
Right.
community involvement. So I'm hopeful
Mhm.
that that's a lesson that we'll also learn.
That's wonderful. That's great. I can see that. I think it's amazing the information that's out there and to
Yeah.
try to decipher it for the providers and then for our
Oh,
patients.
absolutely. Absolutely.
Yeah. Yeah. So what are you doing personally to kind of manage to get through this? I mean, you mentioned your kids are going for a fun bike ride. How are
Yeah.
you doing?
Yeah, my husband and I were just laughing about this because I actually will have very purposeful time away from technology, where I will come home and I will just, come out of my cave from my office upstairs in my house or my car, and my husband's like, technology pause. I'm like, yep, I'm going to grab my dog. I'm going to go for a 5-mile run. I will see you guys later. And so running has been something that has been needed, like it's my therapy with my dog. But I can just feel myself breathing differently, clearing my mind. And if I've only run twice in a week, that third time is critical. Like everybody in my house knows it. Like my kids, like, you can go on a run with Lily. Lily's my dog. You want to go on a run, Mom? And then being aware of that importance for our family too. And so then like more family movie nights. And again, it's that teenager puts the phone away, mom puts charting away, dad puts teaching stuff away. We're watching Ferris Bueller's Day Off. We are going old school and we are going to laugh together. And then, Mother's Day was really great because that was like, that's my day. And so I'm shutting everything down. We're going to plant the garden. We're going to sweat and stink. And then we're going to order our favorite pizza and have it delivered. But I think that it is often forcibly intentional because I can see that it changes and weighs on me otherwise. And if I didn't say, I'm doing this and intentionally doing it, it would be really easy to just make one more message. They're watching Ferris Bueller. I've seen it 50 times. I can just chart and miss those opportunities for being in the moment.
Right.
So it's forced, but I'm trying.
But you have to. That's great.
Yeah.
That's great. Well, I'm trying to think if I had anything else. I love all the stuff you've talked about. Do you have more that you want to add to this?
No, I mean, I was really delighted to just be, anybody even asking me my opinion is always like, really? You want me to talk in front of a camera? Are you sure?
Exactly.
And then understanding that I have verbal diarrhea is the other part. I'm like, you don't want me on a camera. You need somebody to start to pull me off. So thank you for being so patient and letting me be long-winded. It was so nice to meet you.
You too. And I really do. I just appreciate you taking the time to do this. And it's amazing to hear the stories that everyone is.
I can't wait to see what this looks like. It's going to be, I mean, one of your things is like, what do you want this event to be recorded as? And so this beautiful thing that you're going to piece together is going to be such a testament to who you are, but then also give everybody else this beautiful reflection of what we were. Right. So thank you, Erica. Right. I don't know where you come up with the questions or the passion, but you're amazing. So thank you.
Thank you. We have a great team that we get together. And again, I'm so excited to see where this goes.
Oh, absolutely. Well, if there's ever anything else in the public health realm that you want a long-winded primary care doctor to be involved with, you can see how much she likes to get excited. So
I love it.